Yes, really. There's a lot of great information that's going to be presented in the next 45 minutes or so, and we're happy that you're here. I first want to thank you for doing all the work that you've done. I know many of you in the room, how many of you actually participated in this year's point in time count? So thank you so much, and it's the data that we have here in front of us that will enable all of us to figure out what's working, what needs work, how are we doing, how can we do better, where are the gaps, and that's really what this is about. I do want to take a moment and recognize that a few days ago we had a significant tragedy in our own community with a homicide on the east side. The information about that, I will assume, I guess some more information maybe will be forthcoming later, but we don't have any new information at this point in time. But it is a very tragic situation to have a homicide of someone who was out on the streets. I don't personally know more information at this point, but I wanted just to take a moment and acknowledge what had happened the other day with that individual. I also want to recognize there are a number of elected officials, current and former, in the room. From my city of Santa Barbara, we have Councilmember Kathy Murillo and Councilmember Lindsay White. Former council members Grant House and Dave Landecker. From the city of Goleta, I see Mayor Paul Perotti here. And the first mayor of Goleta, Margaret Connell, is here. From the city of Carpentry, I see Fred Shaw in the room. Councilmember Fred Shaw. Thank you very much. These are all the electeds, and I think I saw someone from State Senator Hannah Jackson's office. Yes, there you are. Thank you very much for being here as well. So I'll just start off just giving a general overview of major points, and then other folks here at the table are going to go over a lot more of the details behind the data. And just remember again that this is a point in time count. This isn't a full, complete survey of everyone who's homeless in Santa Barbara, but this is something, and it'll be explained about why it's done the way it's done. But I think one of the things to recognize and acknowledge here is that actually, even coming out of this recession over the last couple of years and moving into 2015, we're seeing a similar number of individuals encountered in the point in time count. So that's something to look at. 76% now this is all self-reporting information in the point in time count, but 76% of the survey respondents said they either lived in Santa Barbara County or some other part of California before they became homeless. I think that was an interesting and significant point that came out. The issue of what happened between last point in time count and this one is the Affordable Care Act, and to see that 74% of the 2020-15 respondents report they're enrolled in health insurance. And we're finding that, we have looked at the roles of what are the ways that we try to get people off the streets and whatever is necessary and the type of services needed for them. And we're finding that the different strategies that C3H has put together about housing first, housing ready, reunification are all important. It's also important that the presence of emergency shelters are still here in Santa Barbara County. Permanent supportive housing are both essential. It's not one or the other. It's a combination depending on the individuals at hand. And then finally, and we'll talk a little bit more about the Mayor's Challenge to End Veteran Homelessness. That's a national initiative that the First Lady started last year in Washington, D.C. We are a part of that here at C3H. But to see that approximately 15% of survey respondents self-identify as veterans, that's pretty consistent nationwide. So we're no more nor less what we're seeing on a nationwide basis. 15% is basically that number that you see on a point-in-time counts all around. And with an average of 8.3 years average length that they were homeless. So some big picture items. We're going to get into a lot more of the details here, but I do want to, again, acknowledge and thank all the work that everyone up here is doing. If we can first give a round of applause about the amount of work that thank you again for your role in it, and our work is yet. We have a lot more work to do. We have a lot of information in front of us, and now we can strategize a little better about how to deal with this very complex issue. So with that, I'm going to turn it back to Zahra.
Thank you very much, Mayor Schneider. So I'm just going to provide a brief overview of what happened during Registry Week. As a reminder, we're really grateful to the over 600 volunteers that came out to be trained and actually conduct the point-in-time count. As many of you know, volunteers went out by neighborhood throughout the county to survey people who are living on the street, in shelters, and in vehicles. So a brief point about the methodology behind a point-in-time count. So since 2003, all continuum of care communities, which is a designation that we get from the federal government, have been required to conduct point-in-time counts of people experiencing homelessness. So the U.S. Department of Housing and Urban Development, or HUD, requires that counts of individuals and families living in shelter be conducted annually, and that counts of individuals and families living on the street be conducted biennially, or every other year. During the point-in-time count, the individuals and families who meet the core definition of homeless are counted. So those who are living in places not meant for human habitation, individuals and families residing in shelter, and individuals and families residing in transitional housing. And I just really want to underscore a point that Mayor Schneider made a moment ago, which is that the point-in-time count is just that. It's a snapshot in a point in time, in this case 2 days during that last week of January. We're not able, through this methodology, to collect exhaustive data on every single person who may, over the period of a year or longer, fall into homelessness. It's just meant to be a snapshot to help us understand more. So another important definition to understand is chronically homeless. A chronically homeless individual is someone who's unaccompanied with a disabling condition, who's been continuously homeless for a year or more, or someone with a disabling condition who's had at least 4 episodes of homelessness in the past 3 years. So this is important because people who are experiencing chronic homelessness tend to be more visible and they tend to be more vulnerable, which means that they have a heightened risk of premature death due to their condition of living on the street and the disabling issues that they are dealing with as well. Chronic homelessness is also very costly to communities. We know that people who are on the street for a long time are very high users of emergency services. They're in the ER more often. They are incarcerated more often, and also use other crisis services at high levels as well. So here in Santa Barbara County, since 2011, we have administered a vulnerability survey in addition to the point-in-time count during registry week. So the vulnerability survey gathers additional self-reported data on the people experiencing homelessness in our community. And again, to underscore a point that Mayor Schneider made, the data is all self-reported. So the volunteers and providers go out and ask questions of individuals about their experience living on the street. It's not going to agencies and collecting their data, although that does play a part in what gets submitted for point-in-time count purposes. But with the vulnerability survey, we're asking people to give us information voluntarily. So this year, for the first time, we used a new tool called the VI SPDAT. This is an evidence-based pre-screened super tool. It's considered one of the best that's out there for collecting information about people's health and social needs based, again, on that self-reported data. The data is then used to prioritize housing and services for the most vulnerable members of our community. For the first time this year, we also used the iSurvey application that many of you who participated are probably familiar with. And that's an app that people downloaded to their phones and tablets. And for the most part, the iSurvey application replaced paper. So it enabled the immediate upload of data, it increased our efficiency, and it helped reduce the types of errors that you would see typically with manual data entry. So I'm going to hand it over now to Rob Fredericks from the Housing Authority of the City of Santa Barbara, and Dr. David Lennon from Veterans Affairs Healthcare, who are going to go over the data with you.
So this slide I want to go over with you. It shows the difference over the previous this year and over the previous 2 cycles of our point-in-time count, the number of people we encountered. And as you can see, in 2011 we had 1,536 encounters, 2013 1,466, and then this year 1,455. So we are seeing a slight decrease, but as Mayor Schneider and Zahra said, that it's essentially flat as far as the number of encounters that we're seeing. Might now want to know, well, where does my community stack up from where I live? And as many of you know that went out and did the survey, we asked the question of, we went out and surveyed in those individual communities and identified where the homeless are in our point-in-time data. And you can see here the comparison again across the 3 cycles of our point-in-time count. And you can see Carpinteria, for instance, is essentially flat with about the same amount of homeless that we've experienced in the past. And that's true across many of the different communities. Santa Barbara is one area that's important to point out that we are seeing a demonstrable decrease in the homeless that we've encountered. Santa Maria, on the other hand, is a community that's we're seeing, when we look at the sheltered point-in-time data, an increase in overall homelessness. So, and then when we combine the overall across all regions, it's a slight decrease year to year, but overall it shows that we still have work to do. I want to point out that in the past we surveyed just Isla Vista Goleta, but we have the capability to pull out the Goleta number from Isla Vista. And in that, so we had 62 individuals that were encountered in Isla Vista, and 37 were in Goleta. So here's another graphical representation of the distribution by region. And you can see that Santa Barbara, for instance, we're having a decrease, all regions decrease when you combine, but there are some slight upticks in Santa Maria, a slight uptick, although it's relatively small, in Carpinteria for homeless. Again, we wanted to gather the data of people's living situation when they're homeless, and we're finding that again, the distribution's pretty similar across the board, with the 38% responding that they're living in the street, on the street, unsheltered, or in vehicles, 16%, shelter, 34%, doubled up, 3%. Living in an SRO, that would be a motel type of living situation, a small percentage. Here's one interesting piece of data, transitional housing, where we see 3%, which is a large decline over the combined data. And really, we think that's a couple of things. We're still looking at the data where that's concerned. With the Santa Maria transitional shelters, we're still trying to gather some of that data, so that may be a little bit less of a dramatic decrease when the numbers do fall out when we're done looking at that. So it's important to note that we have an increase in self-reported homeless among those surveyed in 2015. Location prior to homelessness. Mayor Schneider mentioned this at the outset of her talk. Again, the majority of people reporting where they lived prior to becoming homeless, 54%, they lived right here in our county prior to experiencing homelessness. 23% indicated that they came to Santa Barbara from some other part of California. Could have been Ventura or San Luis Obispo. It's a little bit migratory, but I think we're just trying to point out that, Santa Barbara is not this national magnet for drawing homelessness. It's more of we're experiencing people that our neighbors that are becoming homeless here. More general demographics. The average age is 43 years of age. The oldest contact that we came across this year is 83 years old. An 83-year-old person is living out on the streets, unsheltered. And that's just not right, folks. The average length of time homeless is 5.5 years. You'll see when Dr. Lennon gets up and talks about veteran homelessness, it increases dramatically with veterans that are homeless. We also were able to, using HUD's definition of chronic homelessness, we're able to see that 620 of the 840 people that actually completed the survey meet HUD's definition of chronically homeless. 99 of those are veterans. And you can see the distribution as well between genders on homelessness. We once again asked about foster care, if people had been through the foster care system at some point in their life, and 16% indicated they'd been through the foster care system. 33% of the people surveyed responded that they'd experienced domestic violence. 57% self-reported experiencing violence or trauma during their time out on the streets or being unsheltered. And that's a big increase compared to previous years. And we're trying to analyze why is that compared to previous years. And we really believe that it's because the way we designed the survey, we asked that question up front at the beginning of the survey on the handheld tool. So it's right up front with the point in time survey rather than getting lost down in the back end of the survey where people might refuse as they go through the survey. We also note that there's still a high rate of incarceration, self-reported, people having to go into the jail system and prison system. Pretty high reported rate of going to the ER and hospitalizations. Those are all very costly resources for people to access rather than providing a stable home for people where we can really reduce those costs. So those are just some of the general demographics. I'm going to turn it over to Dr. Lennon now. He's going to go over the veteran data and some more health-related demographics.
I'm Dr. David Lennon. I'm the lead physician from the VA clinics up in the north, Santa Maria and San Luis Obispo, and I've been just appointed the lead physician for a newly formed homeless health pact, which is a patient-centered care program as well that we're putting together now in Santa Maria. So I'm glad to be with you and thank you for all being here. I'd like to start with veteran data, and if you look at the slide, you can see that the veteran average age, the average homeless time is much higher, 8.3 years, than for the general population. And as you would expect, the average age is a little bit higher. That's not up there, but it's 50 years old versus what Rob just reported and we have for all of our surveys, 41-year-old average age. The PIT count is a little bit higher. The distribution of where we're finding veterans is about the same as with the general population. Living situation, slightly more of them are what we find on the streets or in the shelters, slightly less in vehicles or doubled up. 51.8% of veterans surveyed reported PTSD as a serious mental illness. You would expect that somewhat in the veteran population coming back from the various wars. We treat a lot of vets with PTSD. The overall treatment rate, though, however, for veterans with serious mental illness is pretty good. The VA has an excellent mental health capability with psychology, psychiatry, social work, and we are reaching out to over 50% of the vets that do have serious mental illness. Health insurance coverage, you see that about a quarter of those that we encountered are using VA healthcare, but that may be a little misleading because we see a lot of co-managed veterans, meaning that they have Medicare and Medicaid and may be accessing the VA but reporting that they have Medicare and Medicaid as their primary healthcare coverage. So we think it is a little bit higher than the 25%. And what's the next page, please? So as the mayor pointed out, there's a great benefit from all the hard work that the partners have done over the last 3 years due to healthcare reform. I know public health did a major push as far as enrolling people. Our partners on the street, I see some friends in the audience today that I know are out on the streets helping us all the time get people enrolled. So there was a great increase in the overall enrollment on the point in time count to 74%. And then you can see the distribution. We also saw a big increase in Medi-Cal, and we used to have healthcare for the homeless and MIA in the county. That went away with healthcare reform, and so most of the people that now are on Medi-Cal used to be on healthcare for the homeless or MIA. So that was great to see that work was paying off. Next slide, please. As far as the health-related demographics, about the same across the board as far as the chronic medical conditions. There's still a lot of severe mental illness out of the general population as well. Traumatic brain injury is also, there are quite a few that reported traumatic brain injuries, and of course the veterans report high for traumatic brain injury as well. Next slide. I want to point out, oops, I'm sorry, we got ahead of ourselves again. There we go. So I want to point out on this slide, we did use the VI-SPID Act this year, which changed some of the questions. And some were for the better, some were a little bit harder to get the respondents to give us answers, or in general put the data together. For one thing, we see that the coronary artery disease, or what we call hypertensive heart disease, or just heart disease in general, that question was combined this year on the VI-SPID Act. And so we're thinking that the numbers are lower because of that, where we previously asked more specific questions like, do you have hypertension, do you have heart disease, coronary artery disease? So that number is a little bit lower than the general all combined data, and we think that's why. Also, previous studies from Boston Healthcare for the Homeless, and also when I used to work with public health, we would do an annual death review, showed that the warm weather injury and cold weather injuries, we actually have in our area more hot weather injuries than cold weather injuries. And the studies had shown previously that, unfortunately people die all seasons, not just in cold weather. So it's an important distinction to make that, we have hot weather injuries and hot weather related illnesses. And next slide, please. So as Rob pointed out, we have a family database, and we are still gathering data. We're waiting for the Santa Maria region to provide us the individual data that we need to actually report. So this is just very general reporting at this point. You can see that 290 children counted between 2011 and 2015. Average reported length of time homeless for families is 3.3 years. And 9% of the children suffer from some form of chronic disease. And then you can see the locations percentage-wise of where we're finding families. And our definition of a family is if two people are cohabitating, no matter where they're staying together, we count them as a family, whether they're on the streets, whether it's shelters or transitional. And then the actual data, when we do present it, when we get all of the data in, we'll identify families with children, families with just adults. But at this point, because we're lacking the data, we didn't feel it was right to put it out there yet. Okay. Rob.
So, giving you all this data that we've compiled with many of your help that went out and did the survey, and today we want to leave you with what we found are our key observations from this. And first off is the number of individuals that we have encountered remains largely unchanged over the past 3 counts, as I've said. 76% of the 2015 respondents report that they've lived in Santa Barbara County or another part of California prior to becoming homeless. Emergency shelters and permanent supportive housing are both essential to addressing local homelessness, as well as transitional housing and other types of supportive housing services that are needed for families. We feel that those are pillars of C3H, and all of those are needed. People experiencing homelessness continue to face high risk of violence, trauma, serious injury, chronic disease, and mental illness, as Dr. Lennon just went over with you. Really great news was the finding on the health insurance enrollment, and that 74% of those surveyed have now access to health insurance to provide them with the care that's needed. Those are our key observations that we wanted to leave you with, and know that it takes all of us working together and all the organizations coming together to do good work and to get people housed in the most appropriate fashion. And one thing that I want to leave you with as well, as far as the VI-SPDAT survey that we performed this year, why did we do that versus just the VI survey that we've done in the previous 2 years? And that is because it allows us to really look at the people that are surveyed and provide them the most appropriate housing for them. And the VI-SPDAT, what it told us is that 21% of those surveyed need permanent supportive housing. The vast majority, 51%, just need rapid rehousing. They don't need the high-intensive services. They just need some rapid rehousing, maybe some supportive services. And the remainder, 35%, they just need housing of some sort. They're recently homeless, they just need housing, maybe some help getting back on their feet. So that's why we do the VI-SPDAT, so we can really target our resources in the most appropriate way. Rather than putting someone in permanent supportive housing that they don't need that intensive services, we can get somebody most appropriately aligned to those services. So I want to talk to you about our housing placements that we've done since the last Vulnerability Index survey. We've had a lot of good work take place over the last couple of years. In fact, we've housed 284 of our housing placements were housing the most chronic and vulnerable from our previous surveys. 256 children have been housed. This is what's been reported to us on our monthly reporting. 133 veterans have been housed countywide, and that's great. But we know that, from looking at the data today, there's a lot more work to do. There's a lot we need to continue to strive to do to really get our numbers down, to meet our goals on the Mayor's Challenge and Zero 2016, to have virtually no veteran homelessness by 2016. So that's going to take a lot to help us move forward. And to talk about that, I want to invite my friend and colleague up, Jeff Shaffer, who is with C3H and one of my local heroes who's done some really great work in the community, continues to do great work, and he's going to talk to you about our next steps and some regional coordination that's happening. Yeah.
So who's ready to get more individuals and families housed? My role as coordinator is really to work with all the housing shelter treatment partners, community action group partners, coordinate all of our efforts together to house more families and individuals. So there are some next steps. There's a place for you. If you're involved in this, there's a place for you to continue to be involved and walk with us as we do this work. So first of all, one of the major steps we're taking is to create these regional coordination groups throughout the county. There are 7 groups that are currently meeting. We're taking a regional approach primarily because, as the data shows, 54% of those surveyed are living in Santa Barbara County, 23% are from other parts of California. The regions are where the boots on the ground people know who these individuals are. So if it's about knowing who they are and what they need, that's where you're going to find them. The second thing, we are working on expanding housing, whether it be creation of new housing projects or expanding housing through working with private landlords. That's work we're doing, because we won't solve this problem without expanding our housing for our friends without homes. Also creating strong supportive services teams throughout the county in all of our regions, where people that are currently families, individuals that are moving in will also have the support systems that they need so that they retain housing. It's not just about finding housing, it's about creating systems where people stay in housing. So you can see the purpose of our regional coordination efforts to convene housing, shelter, and treatment partners and community action groups to identify and implement best scientific evidence-based best practices that reduce homelessness and the impacts of homelessness in each community. And that's important. C3H exists to reduce homelessness, to solve homelessness, and also to help communities where the impacts of homelessness are being felt as well. Each region will set its own goals and deliverables in coordination with the C3H Policy Council and our coordination community partners. So you both have people with boots on the ground that know where people are and where families are, and you have resources that can come down to them to get the job done. So here you can see, I'm sure everyone in this room fits within one of these groups. So within each one of these regional committees, which I'll tell you about what those are in a moment, those are the partners I'm inviting to the table. So a couple of partners to highlight is really for the first time, I feel like in many ways, we have found a place for the business community to really be involved with us. Throughout the country, cities that are successfully solving homelessness, they involve the business community and leadership, and that's one of our main challenges before us and something we're doing. And also inviting the city staff and county staff to be on board with us to also give some direction is really important. So here you can see where our 7 regional coordination monthly meetings are. So we are covering the county from Santa Maria all the way to Carpinteria, and if you go to our website, you can see the time, so you can talk to me afterwards as well if you're interested in joining one of these. I want to talk briefly about the NOPIS project, which has been going on for a year now, and the reason why is because for that population that we call chronic and vulnerable, that 8 to 12% of any population of individuals who have been on the streets the longest, maybe have a dual diagnosis, are going to need strong supportive services. We created a project working with all these different partners to help house 10 of the most chronic and vulnerable in the Memphis community over the past year. So basically what happened is Restored Policing gave us some data on those who are using the most services. The business community then narrowed that list down for us, and we also looked at our vulnerability index to see if they are the most chronic and vulnerable, and we brought together all the partners and created a way of those partners meeting. And I can tell you about the success of that now. So it's been since February of 2014, 9 out of those 10 individuals are stabilized and no longer living on the streets. So I believe if you look at the total number of homeless cumulative years of those 9 individuals, is 143 years spent on the streets through those 9. We're still working to house the other person on our list and expanding those. We'll work with Milkas, as well as we're now in conversations with the downtown organization to do the same kind of work on State Street. So you see kind of a historic photo of the first time that the downtown organization and the Milkas community team met. And you can also see from that photo the amount of people it takes to gather together in the same room to begin to help some of those who've been on the streets the longest in our communities. It's also a project that I believe we can replicate throughout the county. Santa Maria, you saw the numbers go up for families and probably for chronic individuals. So in Santa Maria, we have to take both an approach of housing, of expanding our housing for those that are in the shelter, and also looking into a project like this work for them, as well as Lompoc, Carpinteria, Goleta, all of our other regions as well. So at this point, I'm going to bring up Emily Allen, and she is the program manager for Common Ground Santa Barbara County under Legal Aid, and she's going to talk about volunteer outreach. Thank you.
First, Stephen Groover, our volunteer coordinator for South County, like me, would like to just thank everybody who did volunteer in any way. I know there are people who got up and went out and counted, but also people helped get the word out and did a lot to make this count and survey so successful. So since 2012, Common Ground Santa Barbara County has recruited, trained, and retained Registry Week volunteers. And we've just been inspired by the number of people who've signed up and participated, and really tried to find ways to keep them involved in a year-round way. So we have street and shelter outreach teams that are starting in Santa Maria and Lompoc, and that's in partnership with Good Samaritan. And in Santa Barbara, we have some long-standing teams that have been doing volunteer outreach. They go out on a weekly basis, Milpas, Pershing Park, Alameda Park, Rescue Mission, and we're, as Jeff mentioned, working on getting the State Street efforts off the ground, and also Goleta and Carpinteria teams. There's a lot of interest in developing teams in those regions too. We also have housing support teams that meet weekly at El Carrillo and the Newfalding. And just to give you a sort of a snapshot in 2014 of what we've been up to, we've trained over 100 volunteers that work with our teams and other nonprofits in the community. Our trainings are open to all volunteers who are interested in getting involved with us or other nonprofits. And the volunteers that contributed to our teams contributed 2,847 volunteer hours. And we are part of a project with public health where we are Medi-Cal navigators and connecting people to certified enrollment counselors for Medi-Cal, and also connecting people to other supportive services that they need. And we've created a resource guide that's used widely throughout the county and by our volunteers. And in 2014, helped 22 vulnerable individuals into housing. So in 2015, what we're looking to do is to support the development of volunteer opportunities for people throughout all of the regions of Santa Barbara County. And what this survey and this account really tell us is by learning names, documenting stories, and understanding the most urgent needs of our homeless neighbors, regions can take critical steps towards moving people off the streets and into housing. And that's the Common Ground website, and you can always go there for ways to volunteer. So now I'd like to reintroduce Mayor Schneider to talk about some of our national.
So there are two national campaigns that C3H and members of our Santa Barbara County community have embarked, and they're bold, they're audacious, and we want to do everything we can to meet them. It shows from the data that we have our work cut out for us, but I think given the focus and attention that we're placing on here, anything is possible, and so why not have these amazing goals? The first one is the Mayor's Challenge to End Veterans Homelessness, and this was something that First Lady Michelle Obama put out there to mayors across cities throughout the country. And it's not just for mayors. There are county supervisors, there are governors, there are elected officials from throughout the United States who have signed on. Over 400 elected leaders throughout the country have signed on to the Mayor's Challenge, including C3H. We did that late last year. So we are part of this, and the idea is to end veteran homelessness by the end of this year, by the end of December 2015. So again, big, audacious goal, but if you look at the numbers, we think with a focused effort on veteran homelessness, and again, when you house a vet, you might house their family. You also figure out where the gaps are in services, and that can help other people who are homeless who may not be vets. So while the focus is talking about veteran homelessness, it'll have positive other effects throughout the county in terms of the system in place. The next one is very audacious also in terms of 2016. C3H, through the Continuum of Care Board, right, applied for and got to be one of 71 communities throughout the country to be participating in 2016. This is something through the U.S. Interagency Council on Homelessness. This is basically looking at a support, actually it says veteran homelessness, it's chronic homelessness also by the end of 2016. This is a big deal here, and the idea behind it is to create a system in place so that if someone becomes homeless in a way, they don't fall into becoming chronically homeless, that there's a process in place through whatever system, whether it's Housing First, rapid rehousing, emergency shelter, whatever system works, make sure that we have a system in place so homelessness is not a pervasive issue in our community. So how do we do that? What are we doing moving forward? And I think what's been helpful to me, and I think important for us to think about as we look at the data, is that it shows what trends may occur in our area and show where the challenges are. And so certainly looking in our area, we know that housing is a big issue. We're not big cities like in Los Angeles when you hear Mayor Garcetti says, I'm going to rebuild this old dilapidated building and build 200 units within a month. It's just not possible here in Santa Barbara County. That's not how we're structured. However, how we look at creative housing solutions is something we can do. And there are ways, whether it's about home shares, master leasing, other incentives for private landlords to rent to people who are homeless, looking at the meetings that happen on a regular basis, really focusing on what can happen in different regions. And as Jeff was mentioning earlier, different parts of Santa Barbara County may need a different focus. City of Santa Barbara might have a different focus. For example, the Milpas Project, they're looking at State Street versus up in North County when we're talking about family homelessness. Or there are families who are homeless here in the city of Santa Barbara as well. A different focus might be needed for each of those. But that's the point. The point is to use the data we have in mind to get the information we need to focus on the results. And one of the things I'm very excited about and to introduce to you is a project that's just about to be launched. And I really want to acknowledge Social Venture Partners, who's been a key partner in all of this, and their research, the amount of research they did in developing what's now becoming a new project in terms of one of those creative housing solutions. And with that, I'd like to introduce Glenn Batchelor to the podium.
I'd first like to see a show of hands of those of you out there that would like to hear about arguably the best homeless housing program in the country. Anybody interested? See, when you go last, you have to do something to make sure you have everybody's attention. But I actually am going to talk about that. There has been a task force, or a team, if you will, that have been looking at creative housing solutions, which the mayor talked about just a moment or two ago. And it really started with a very simple premise. And that is that there must be somebody out there that is doing this well. And if so, let's not recreate the wheel. Let's find out what's working, and let's try to replicate it if we can here in Santa Barbara County. Sounds right? Does that seem like a reasonable approach? Well, I'm happy to report today that that team has identified a program, and we're going to be rolling it out in the next several months. And that program is called the Landlord Liaison Program. It's out of Seattle. And no surprise, because Seattle really is a hotbed of innovation and creativity in a lot of different industries and a lot of different areas. And this has been recognized on a federal level as a national best practice program. And what's comparable here for Santa Barbara is there's a lot of similarities between inner Seattle and Santa Barbara. Very low vacancy rates, very high rents, and the distribution of public and private housing is about the same, 90% private, 10% public. So there's a lot of similarities between Seattle and Santa Barbara. And one of the real strengths of this program is that this was created with landlords. They didn't create a program and then go to landlords and try to sell it. They went to landlords and said, as a community, we have a problem. Can you help us try to solve that? And landlords were in the group that put this program together. Sounds like a pretty good idea, huh? Get landlords in the tent rather than outside the tent. And yes, the results have just been astounding. Over 4,000, it's actually closer to 5,000 homeless folks have been housed in less than 5 years in this program. And just to put it in perspective, this is not Seattle housing 5,000 homeless people. This is one single program in one single organization, which happens to be the YWCA, that is housing almost 5,000 homeless folks with private landlords. It's pretty astounding, the results. And you may be wondering, well, how the heck do they do it? Well, very simply, the other magic about this is that it uses existing infrastructure. We don't have to change a whole lot to be able to do this. Social services agencies can pretty much do what they're doing now, which is working with clients, providing supportive services, in some cases providing financial support. But in this case, they'll be referring some of these folks to the Landlord Liaison Program staff. And the Landlord Liaison Program really acts as a broker between the supportive services and the landlords. And what's interesting about this is there's a pre-existing contract between them and the landlords. And basically brokers the transaction, if you will. And of course, a lot of it has to do with what's in that contract, which is on the next slide. Essentially, landlords are asked to do one thing, which is to agree to relax their tenancy requirements. And you say, wow, that's a pretty big deal. But they can do that on an individual basis. They can do it as little or as much as they'd like. And obviously, it has to be within fair housing regulations. And in exchange for that, they get a menu of things that really dramatically reduce the risk for them. And I want to stress a few of these things. You can read down the list if you like, but a couple of things I really want to stress here is number one, this is a program for tenants who are ready to succeed. This is not the most vulnerable. It's not the ones with the most issues. These are folks that are homeless, but they're ready, maybe not immediately, but in a short period of time to be successful. So I'm going to be very clear about that. And then there's a number of things like a 24/7 hotline, supportive services for at least a year, ongoing training, there's mediation and eviction, fast eviction help. There's a 7-step program in terms of that. And I really want to stress the next to last one here is a financial safety net. Essentially what the contract does is says to the landlord, you almost cannot lose money on this. You know, above and beyond the security deposit, if there are damages, if there's lost rent, if there's court or mediation costs, the program will help pay you for that up to a certain point. So it really dramatically reduces the risk for the landlord. And again, we're dealing with people that can be successful. And also there's move-in monies that could be involved with it as well to, again, help to create the success for these folks. And, you know, as astonishing as the number of people that they've housed, maybe even more astonishing is that, the statistic they have is that 94% of these folks that are in this program, the housing program, are still housed a year later. 94, which is more than the general population. So it's amazingly successful. Just lastly, the intention is to roll out this program in the next several months. And much like in Seattle, even though there was already a blueprint, we wanted to make sure that the square peg wasn't in a round hole here in Santa Barbara. So we wanted to make sure that if we needed to customize anything, that we would. And so we've had, been working with landlords, first of all, a number of different landlord organizations, individual landlords, and we continue to do that. And you can see the list of organizations here that have been helping to make sure that it fits and customizes well with the Santa Barbara area. And we're really excited about it. The one thing I would say, though, is a program like this, the results are not going to happen overnight. It takes time to get traction on a program like this. It didn't take off the first few months, or it took a year or two for it to really go. But if we can replicate, or even remotely replicate, the type of results that Seattle has, this would be a big, big step in addressing homelessness. Time will only tell. Thank you very much.
I'd like to thank you all for being here today, and I can do my best now to field some questions and direct them to those who may be best suited to answer on our panel.
It strikes me from having gone out and done this that the logistics of doing the survey overcount those who are in shelters because they're pretty easy to find, and undercount people out on the streets. And I just wonder, when you do this analysis, number one, whether you compare the demographic, or what we find out for those people, but whether there's any adjustment made in terms of analyzing this, the fact that we really are overcounting shelter homeless versus particularly people with vehicles, I would think.
Robert, Dr. Lennon, to you.
Well, in the master database, that includes all data for all years. We do have exclusions, and we exclude out duplicates, obviously. Finding people that are living in a shelter one day and then they're on the streets the next day, they would be filtered out. But as far as doing reports on specifically for people that are, living outdoors or in their vehicle versus in shelter, we're not going to have specific data on that.
I just know when I was out there, you could tell I wasn't finding everybody. If you go to a shelter, you just walk around and get everybody. It's 11.
And the data that we present to HUD through AJ's office is here with Santa Barbara County Housing Community Development. They do ask the shelter separately for their shelter point in time counts so that we can compare the race.
Consent to participate in the survey. There's, my colleagues can speak to this, there's other data that's collected outside of the vulnerability survey that deals more with homeless children experiencing homelessness.
And the surveys that we did complete, they did indicate that they had minors 18 years and younger. We did ask them for their gender and their age, so we do track that we're able to collect.
Sir, in the back over there.
I have two questions. First question is, we have an increase in number of families. We have this goal for veterans. We've also identified over the years the most vulnerable in order to reduce the deaths on the streets. So is there a sense of where the priority is here, or is individual case by case? And then my second question to Glenn, if I could, if Seattle had a really low vacancy rate, Santa Barbara does too. I have a lot of friends who scramble to look for a place. What incentives are being given to landlords to work with our population?
I'll start with the first question first. Stand up so I can see people. I think that's the point of the regional coordination piece in terms of prioritization and to focus on what needs to be done in what part of the county and trying to customize the type of approach. And as you can see from at least the city of Santa Barbara data, there's been a decrease there, and I think part due, my look at it, in part due to the focus of looking at chronically homeless and the housing placement piece. The veteran home, the nearest challenge of veteran homelessness, again, remember, some vets have families, and so if their families are homeless and they're a vet, the family's also going to get housed too. So it's not an exclusive, just you're going to be housed and not their family. And I think the rapid rehousing program a lot have helped with a lot of families. And I hope with Jeff talking about initiating this regional approach in Lompoc and Santa Maria, that's a relatively newer approach, and I think we hope that we're going to see, especially since a more proportional amount of homeless in that area includes families, we'll see a decrease in that area. But that's part of what the point in time count is supposed to tell us, where are the gaps, and if we see an increase in family homelessness, that's telling us we need to focus on that issue. And then on the rent.
Yeah.
I mean, on incentives, I covered that a little bit, but I'll add a few things that I didn't mention. First of all, there's a thought to begin the program with emphasis on veterans. And landlords are very supportive of housing veterans. So the combination of the program plus veterans, we think is going to be a powerful combination. The 6 or 7 things that I put up there on the menu are absolutely incentives for landlords, and we've gotten feedback from local landlords that they could react to that. But on top of that, to your question, we're also thinking, particularly in the South County, where the vacancy rate's even lower, that we may need to even add to that a little bit. So we're actually thinking about possibly considering some other additional things as well to make sure that people are properly incentivized. But no matter how incentivized the program is, it's never going to be a program for 80 or 90% of the landlords. Even in Seattle, they only have 4 or 5% of the landlords that are in the program. The problem was it was almost 0 before. So we're talking about a relatively small amount, but we're very cognizant of what the incentive should be.
And to the first point again, I think about these national programs, we have found that since initiating the process of being part of the Mayor's Challenge in 2016, the relationships that we are now having with the VA and other federal agencies has improved dramatically, just by virtue of speaking the same language, focusing on the same kind of program. There's perhaps access to different funding sources we didn't know before. So we think by being a part of something that's happening on a national level will help us locally here. So I think that's part of the idea why we chose to focus on those national initiatives.
Other questions? Here?
Hi, thank you all for being here. I wanted to ask if we were interested in getting involved in either volunteering or for helping with the logistics of starting a landlord liaison project. How would I do that? Or how would we do that?
I love that question. I paid her $20 for that. Well, it's great that you mentioned that, because we're actually thinking, I didn't mention this as part of the presentation, but this program is not going to be a standalone nonprofit. It's going to be a program within an existing organization, and that organization is Transition House. I'm really pleased to mention. And they're going to be the fiscal agent. And we're working on the organization, but the thought is there'll be a small working advisory group that will advise that, not be overly bureaucratic, but really try to be helpful for the staff, and a group of volunteers. So come see me, you and anybody else, come see me afterwards, and we can certainly talk about it. Thank you.
I want to follow up on that too, as I mentioned. If you want to join a year-round volunteer team, or if you want to see a listing of nonprofits that have volunteer needs, you can go to commongroundsv.org. Also, if you're a social media person, you can look for us on Facebook and Twitter.
And I also just wanted to mention that Jeff and I are happy to help direct anyone who's interested in getting involved. Our contact information is up there, so if you have other questions, if you want to get involved in a way that's not totally obvious at the moment, you can reach out to us via phone or email. And Rod has also reminded me, our presentation from today will be posted on our website later this afternoon.
name's Gordon. I've been homeless for 6.5 years. This year, Ms. Mayor, I will not be celebrating that I've been here 5 years homeless. I'd like to know how much longer. The people in the housing department, I'd like to know why you don't factor in the length of time you're homeless. I'm 463 on a list after almost 5 years on the homeless list. So when are you going to start building some housing? It's nice to invite some landlords that might participate, but I know how that goes too. We need housing in this city, in this county. I'm tired of being an economic refugee in my own country, in my own city, in my own county.
Thank you for speaking up. And I see members from the Housing Authority here and other placement agencies, and I know our city, we've changed the way we incentivize housing to try to create more affordable housing, but it's in this area, I agree with you, it's an extreme challenge, and we're not a place where we're going to build ourselves out for everyone who wants to live here, and that's a reality I think we have to deal with, and there are consequences to that, and I think as long as we work together in terms of focusing on folks who can interact with the services provided, hopefully we can reach out and connect with as many people as possible. But it is a challenge, I won't deny that.
Yeah, you mentioned the Santa Maria numbers are up, yet some numbers are still missing. Is that just the shelter beds and or it's a need to trade out? Or is it,
it's transitional housing that we're missing. Okay, this is why. We're mainly family information.
First, I want to thank you very much for turning around the data so fast. We only did this like a month ago, but that was really fast turnaround. I appreciate that. And as a person on the Homeless Outreach Project, thank you for also getting this being involved and being part of the solution. One of the things I would like to encourage is I notice it's kind of on cities to solve these problems for themselves, and we're doing regional efforts. But the county is the one that actually provides a great deal of the resources through public health, mental health, et cetera, that could be leveraged to help with this. And I would like to encourage, us to work really hard on getting some monies available to the Mental Health Services Act that can pay for and build and provide supportive services and supportive housing. That this is a resource we haven't really tapped, and we probably should in these efforts. Thank you.
Thank you. And as many of you know, C3H, the Policy Council, represents, there's 2 county supervisors and then 8 members from 5 different cities. And as a member of the Mental Health Commission for the county, I'll lobby back to you that we could use some of that money from however it works. But that's the idea of having the Policy Council, so that it's not just one city or just the county. It's difficult, but we need to connect. And I see some other members from the county here, AJ, thank you.
Rolf in the back.
I'm here representing the California Center Coast Society of Asian Americans, and I was wondering, as far as demographics, are there Asian Americans, or if you have divided? But my main question is, what type of not meant for human habitation did you find the worst type? Because did you do the survey in the morning? Because I know these types of not fit for human habitation come up, especially at night.
Right, so the survey was done early in the morning on the 28th and 29th, and places unfit for human habitation has a relatively broad meaning. So it can mean someone who is sleeping on the street, someone who's sleeping in a car, someone who is sleeping in an alleyway, or a place that's otherwise not meant for human habitation.
So did you actually encounter those people there?
Yes. And on the demographic question, I'm going to toss that to Rob and Dr. Lennon.
Sure. So 0.7% were self-identified as Asian. Is that the question? Yes.
Rolf?
Two questions, and if these are too far in the details, fine. One for Rob, one for Dr. Lennon. There were 2 data points on the survey you presented which struck me as pretty far outliers. First of all, the number that 0% of people reported from being out of state. I mean, I knew it would be low, but I'm just wondering if we really didn't get anybody answering that they came from out of state. And the second one that I'm just curious about, Dr. Lennon, is it looked like there was a 60% 60% of people are on prescription medication as opposed to a baseline of 25% over the past 3 years. I'm just wondering if that's accurate, and if there's any way we can account for both those questions as far as what we did, as far as what questions we asked or what the surveys were.
Yeah, like I referred to previously, this is the first time we've used the device for that, and the first time we've used handheld devices to actually capture the data.
Okay.
So we're not sure about some of the really outliers, like that, for instance, and the out-of-state, what happened. Maybe it's just better self-reporting, maybe it's better capturing of the data. But yeah, we won't know that for sure until we get a few of the VI SPDATs surveys under our belt and can look back at trends.
Sure.
Well, same with the out-of-state, that was a question on there, and zero did answer it out-of-state. Yeah, 20. So there 24% didn't answer the question, so they may have been out-of-state.
Sir?
Hi, I have a question that follows from the person who asked the demographic question. First of all, I like the survey. I thought he ended up doing a very good survey. I serve on the Mental Health Commission, and we keep well track of what's going on. But I also have a demographic question, and I know the survey was looking at the very severe homeless, but in my community, the Latino community, I'd like to eventually for you to do a good survey there to find out how many families live in one house. When you have 4 or 5 families and they sleep in shifts, do we stop counting them as homeless because they're not sleeping in a park but are sleeping in a garage? They don't have the kinds of services they need and so forth. So I think we need to, the next time you could get your surveys written up and you look at the methodology, to somehow or another squeeze in some questions relative to that population, which is a significant group of this community. The other thing is I'd like to mention as a mental health commissioner is that whenever we try to get housing for people in the mental health system, we get a lot of opposition from people who don't want the mentally ill living next door to them. And so I think when you're looking at the Seattle project or any project you look at, I think you need to take that into consideration. Because if 64% of the veterans, supposedly according to your stats, are in need of mental health services, that eliminates a lot of individuals. And if they were looking for housing in this community, because aside from being veterans, they're also stigmatized for their mental health problems or issues that they contend with. So these are issues I think that you have to either broaden your scope when you do your next planning and make sure you take those issues into consideration so that the data that you get, which is very valuable, will even have more valuable to the whole community.
So that demographic that you referred to is the most difficult demographic to obtain at a point in time. We're going out early in the morning, and to bang on someone's door to find whether or not they're homeless, number one, is almost impossible. That's why we are moving forward with doing the surveys outside of the point in time. We've always done that. And so it's very valuable for us, for people like yourselves who know there's a pocket of homeless people, and doubled up is considered homeless. We consider that if you're doubled up for less than a year, then you are homeless. So if you can tell us where to go, we have outreach workers that can go out to those locations and perform the survey and get those people in the database so that they're represented. As far as the serious mental illness, yes, that's a huge issue. These folks are not only the hardest to reach, but the hardest to treat and the hardest to house. And we try to get as much support as we can for serious mental illness. I think mental health has done a much better job over the past few years in reaching out to the seriously mentally ill. As I reported, 64% of veterans do self-report serious mental illness. We're getting to about 50% of them that are telling us they are receiving treatment, but that is also probably the most troublesome demographic and hardest demographic to reach out.
Please feel free to reach out to me or Jeff. Our contact information is up there. And again, the slides will be posted on the website c3homes.org later today. Thank you very much.